So we talked about the first dose and the second dose. What about subsequent doses, and how long is someone expected to be on this type of therapy?
Yeah, so you have the first doses separated by a week. You get a third dose a week later, so that's day 1, day 8, and day 15. And then typically we dose it every 2 weeks after that. Even patients that have a reaction with those initial 1 or 2 doses, the likelihood that that reaction will recur with subsequent doses is vanishingly low. On the order of 1 or 2% of patients may have a recurrence of some of those scary inflammatory reactions. And so it becomes a very safe and easy drug to administer quite quickly if you can get through those initial 1 to 2 doses. The plan for the treatment is an indefinite one. And that's true for almost everything that we do in extensive stage small cell lung cancer. Until it stops working or becomes intolerable, we'll continue it. What we've learned in other tumors, however, is that when you engage the immune system, there may come a time where you've effectively treated the tumor and continuing to give a drug every 2 weeks is unnecessary. We're way too early to know whether that will come to pass with tarlatamab. But certainly there are precedents, say in non-small cell lung cancer, where you might stop immunotherapy after 2 years because the immune system is already done all it's ever going to do. And so we hope that this is not a situation where we're giving this every 2 weeks for 5 or 10 years, right? That we find that the patients that have these deep, durable responses don't need to constantly have their immune cells stimulated to continue to attack the tumor. But time will tell.
Time will tell on that, yeah. I just wanted to make sure that people understood it was really the first 2 doses that were the most important, because it can be terrifying, right? Particularly from the person diagnosed with a small cell lung cancer to think, wait, I have to spend the night in the hospital, and this is a good idea because, right? And as Dr. Gay said, it is precautionary for those who may respond or have that overzealous immune response to the therapy. And I think it's one of the reasons having conversations like this are so important, and one of the reasons I believe people talking to people, patients talking to patients, caregivers talking to caregivers is so important. I just spoke to someone today, a small cell lung cancer patient, extensive stage, who is on tarlatamab, and she did have an adverse reaction, and it was a delirium type of neurological reaction. But fortunately, she was in the hospital when it happened, and I'm happy to say she is still on therapy. And she's like, I haven't felt this good in 3 years, right? So being able to talk to somebody who's walking the walk and can share that sort of lived experience, I think is also an incredibly important part of this, not just, us sitting here and speaking sort of at you about what all of this is, but speaking with one another. And as I think a lot of you know, GoTo has a small cell lung cancer community where we are more than happy when we can to try to make those connections. So I just wanted to do give a little bit of my input there, along with a shameless plug to some of the supportive and connectivity community type services that we can provide.
This is so true. Demystifying this drug, both for patients and even for some of the physicians out in the community, has been challenging. And I think patients demystifying it for other patients is going to be much more effective than anything that I can say, right? I mean, telling a patient that something very scary might happen to them, but they will probably be okay, I can see how that would provoke anxiety. But seeing patients that have come out the other side of that, who are now getting it as an outpatient, who are back to their normal lives, I think that's really, really the key. And I think the longer we have this drug, the more patients we'll have like that, who say, yeah, I had one of these supposedly very scary reactions with the first dose or the second dose. They knew exactly what to do about it. Somehow the antidote worked, even though I was in an ICU setting potentially. And now I come in, get an infusion once every 2 weeks, and there's not really any harm at all.
Yeah.
And so I think building a community around those tarlatamab patients that are through the toughest part of it is more valuable than anything that I can tell my patients.
Yeah, or I can tell people that walk in the door. I think about, you made a really good point about it's not just about the patient and the caregiver community banding together, having these conversations, sharing these lived experiences, but also the healthcare provider community, right? You mentioned not all healthcare providers are, have the benefit of an inpatient unit where they can house people, for the night. So how do we work to help educate healthcare providers on this type of therapy and how to effectively administer, particularly in the more rural community type settings? One of the things that, again, for those of you who are not new to Go To already know this, but we have a Center of Excellence community that's particularly focused on the community, cancer center, community screening centers, you name it. There's about 900 centers in the Center of Excellence network right now where we are working to try to help educate the healthcare providers in those types of settings on tarlatamab in particular, because we think it is such a valuable new tool in the toolbox from a treatment standpoint for people diagnosed with small cell lung cancer.
Yeah, I think the upside is so high with tarlatamab. The durability of some of these responses, even in the short time we've had the opportunity to utilize it in trials. Even though it can be challenging logistically, we've been very open, at our center, and I know at many other major centers, about we'll do the first 1 or 2 or 3 doses here if that's what you're afraid of, and then if you can take over the outpatient and the patient can go back to sleeping in their bed from there. But even that is a barrier, right? Not everybody can spend 48 hours in Houston 3 weeks in a row.
Right.
And there's some people that have children or pets or what have you that they can't leave. And so making sure that everybody has tarlatamab within a drivable distance from them is really critical.
So I'll be brave if you're brave. I'll be brave, but oh